Thank you everyone for joining us today. Today's presentation is intended for personal care agencies here in the state of New Jersey, and we will be discussing guidance for avoiding fraud, waste, and abuse in the Medicaid space. And today I'm joined by, so I should start by saying my name is Melanie Donnelly, and I am part of the Office of the State Comptroller here in New Jersey. And I am joined by representatives from the Division of Medical Assistance and Health Services, also called DMAS, the Medicaid Fraud Division. I have other colleagues here with me today, the Medicaid Fraud Control Unit, and several of the New Jersey Medicaid Managed Care organizations. And I'm excited to be part of this excellent group. And before we dive in, one of the most important things you want to do is to thank all of the New Jersey Medicaid personal care agencies for participating in the NJ Family Care Program. The work that you do is so important, and I know you probably don't hear thank you enough, so thank you for the work that you do. We do want to just mention that this presentation is intended for general educational purposes only, and it does not replace your responsibility to seek professional guidance, observe all laws and regulations that pertain to your practice as a Medicaid provider, and exercise sound, independent, and professional judgment. So throughout this presentation, you may hear the words Medicaid and NJ Family Care used interchangeably, and that's because NJ Family Care is the name of the Medicaid program in New Jersey. NJ Family Care includes Medicaid, CHIP, which is the Children's Health Insurance Program, and Medicaid Expansion, with services provided both through the state and 5 Medicaid managed care organizations. So the goals for today are to help you better understand the Medicaid regulatory framework and program integrity oversight, the personal care agency providers' responsibilities for compliance, including electronic visit verification. So that's something we'll touch on, as well as EVV. I'm sure that that's something you may have questions about. Medicaid documentation requirements for payment, obligations for avoiding fraud, waste, or abuse of Medicaid funds, and the consequences for non-compliance. And if you have questions during the course of the presentation, put them in the Q&A if possible. Putting them in the Q&A preserves a record for us. And if you include your email address, if we're not able to answer your question during the course of the presentation, we will have a way to find you afterward and get you an answer. So we do intend to take all the questions that we received today and compile them into a Q&A document that we will send out to all of today's attendees at some point in the near future. I will also mention that the presentation today is being recorded, and a copy of the recording will be publicly available on the Office of the State Comptroller's website in the coming weeks. So that will be available for you to use as reference. So I'm going to start by talking about what is Medicaid. So Medicaid is a joint federal and state program that provides funding for medical costs and services for eligible individuals. And participation by providers in the program is voluntary. If you want to participate in Medicaid, you need to know, accept, and abide by the rules and regulations, and continued participation does require compliance with regulatory requirements. This slide provides an overview of the various New Jersey state agencies that are involved in overseeing Medicaid. And so in bold are the areas that we touched on earlier, which is the Medicaid Fraud Division, the Division of Medical Assistance and Health Services, and the Medicaid Fraud Control Unit. We also have noted here the Medicaid Managed Care organizations, which have a contract with DMAS to fulfill their obligations. And then down in the sort of bottom right is, in yellow, is HHA exchange, and we'll touch on them a little bit later in the presentation, but they are the electronic visit verification aggregator, and they hold a contract with DEMA. So DEMA appointed them as the contractee for EVV, and as part of that, they have obligations that they must fulfill as well. So just kind of gives you a lay of the land of the various areas that are involved in this oversight process. And wanted to mention, as discussed earlier, there are 5 Medicaid managed care organizations here in New Jersey. We've got Aetna Better Health of New Jersey, AmeriGroup New Jersey, Horizon NJ Health, United Healthcare Community Plan, and as of today, it's called WellCare Health Plans of New Jersey, but their name will be changing on August 1st to Fidelis Care. So in conjunction with these 5 plans, they provide the services for about 97% of our Medicaid beneficiaries here in the state of New Jersey. So they play a very important part in this. And I'm now going to turn it over to Geraldine Molinari from the Division of Medical Assistance and Health Services to talk a bit about regulations, newsletters, and background checks.
Thank you, Melanie, and good afternoon. So, hold on one second. This always happens on. Okay, so as Melanie outlined the structure of New Jersey Medicaid and the fact that there's also federal overlay to the Medicaid program, what I'm going to outline is just some of the key areas that you as a provider, if you elect to enroll as a Medicaid provider, what the expectations are regarding requirements. So we'll start with enrolling. Provider enrollment in the last 5 years has changed. The 21st century, a federal requirement of the 21st Century Cures Act requires that all network providers complete the 21st Century Cures Act provider application. And what that means is that if you as a provider want to contract directly with one of the managed care organizations, before you can do that, you need to register with New Jersey Medicaid. And the way you do that is by completing a 21st Century Cures application through Gainwell Technologies. And on this slide, we have the link to the NJMMIS website and also the detail around where you would access the provider enrollment applications. And at this time, all applications can be submitted electronically to Gainwell. So if you're going to want to work just with Fidelis Care, you are going to have to be sure that you also enroll with New Jersey Medicaid, because the health plans are required to be sure that you are enrolled as a 21st Century Cure provider. If we go to the next slide, just some basic regulations and guiding principles that you as a New Jersey Medicaid enrolled provider providing home health services should follow. You need to be sure to follow the regulations that who can provide the services. Depending on the service, the qualifications of the individual staff must be followed. And also, as a provider, you have to be sure that the members meet the state's criteria for eligibility for the individual services. And if there's limits on services, you need to be aware of those as you provide them services to the members. And in that realm as well is, what are you documenting in order to outline what you provided for the member? And that documentation will have an impact on what is determined to be allowable versus not allowable services. There's also frequency guidelines for the services, and you would find that in the service descriptions in the managed care contract. And also, as you work with the managed care plans, they will outline authorization details for you as a provider serving individual members. All the billing codes can be found on the Gainwell site. This is the fee-for-service code and rate information. And you would have to look at your MCO specific information because perhaps based on an individual arrangement, there may be a different rate for different services. So the general code information that the state has is outlined in the fee-for-service code information on NJMMS, but you may have different information and rate structure for the individual MCOs. The next slide. So as a provider, you're bombarded with a lot of different requirements. And in order to be sure that you are staying on track for all of the requirements, especially in the last 3 years, as we might have had a waiver for something for COVID, all of the policy changes that occur from Medicaid are outlined using newsletters. And all the newsletters can be found on the NJMMIS website. And as a provider, when you agree to enroll as a Medicaid provider, you're expected to be aware of those requirements. So it's imperative that you have staff that always are monitoring what newsletters are posted. And, you know, NJMS does, or Gainwell does send notices, but everything is posted. It stays on the website forever. So you should be aware and be tracking based on provider type what you need to be sure you're following. And especially in the world of, you know, as you contract with 5 different MCOs, perhaps, you will see the general information on the NJMMIS website, and then you then have to follow the different structures that each of the MCOs will follow. Next slide, please. So as we talk about home health and EVV, this kind of gives you just a general summary of all the information that we've shared regarding EVV using the Medicaid newsletters. So we started in 2021 with the first newsletter that was published just regarding what was expected and what were some of the implementation requirements. And I fast forward to 2023, there's different newsletters in between that give us some guidance, but we've arrived at a point where now that we're going to be in full implementation mode for all services, we will have 4 core newsletters to go to explain what's required for EVV. And the newsletter volume 33, number 11, is a critical piece of information and updates. It outlines the rounding rules for home health and personal care services and is a combination or replacement for 2 existing newsletters that were published in 2018 and 2019. So you should be aware of what those requirements are and make sure your staff is aware as well. And then volume 33, number 12, which was just posted this month, outlines the timeline and requirements and the service codes that are included in the phase 2 EVV implementation. The volume 31, number 1 includes the phase 1 services. And then we anticipate about a 18-page newsletter to be posted after August 1st. We're just finalizing the details, and that will be an FAQ that will combine previous FAQ and where we stand right now in the full implementation of EVV, so that you as a provider can use that as a resource, and as new staff come on, they will have the basic outline of EVV requirements, MCO structure, all in one place. So we can't stress enough how important it is for you as a provider to use the NJMMIS website and the provider newsletters as a tool to understand what requirements have been updated or are required. And that's just to touch very high level on qualifications and background checks. This slide gives you just the cursory expectations. And if I were as a staff, the link on the bottom, the consumer affairs phases and timelines, that is something that needs to be followed and understood. And for you, if you're tracking how your staff is doing in getting their qualifications, those resources are really very key. But the provider is responsible to maintain a copy of documentation that all staff is qualified and trained as a CHA. They have to verify the credentials, the certifications, and the license. That comes up on the provider as you're contracting with the MCOs and servicing the Medicaid members. And when you have new staff, obviously you have to be sure that there are no disqualifying issues that would permit them from providing the services. And as it's outlined here, if there is no background check, that's the delay that will happen for CHA applications to be completed. So in the, as we outline here, scheduling fingerprinting as soon as you have the instructions, that's critical because that will delay the processing of the application. And again, the website there has a very good tool of just outlines the each phase and what the staff should be doing to complete their certification. So that's the end of my formal presentation. I just say to you as a provider, it's critical. You need to be very familiar with the Medicaid newsletters. The staff need to be familiar with the Medicaid newsletters. And in terms of getting certified, you obviously following what's in consumer affairs is critical. Thanks.
Good afternoon. My name is Megan Brennan, and I'm with Horizon NJ Health. Today, I'm going to be providing you with a high-level overview of the New Jersey Board of Nursing regulations, specifically those that apply to licensing and/or certification for certified homemaker home health aides, or CHHAs. Before we begin, I want to inform you that, of course, this information is for informational purposes only. This material is not intended to be a substitute for any New Jersey Board of Nursing policies or regulations. Therefore, please contact New Jersey Consumer Affairs or the board directly for any questions you may have regarding the licensing process in general and all applicable, all regulations. All right, next slide, please. Okay. What are we going to talk about today? As Geraldine referenced previously, New Jersey Consumer Affairs, they have multiple resourceful information regarding guidelines. One of them is a consumer's guide to homemaker home health aides. And again, you can access this information directly from the New Jersey Consumer Affairs Board of Nursing website. One of the nice things about this guide is it defines everything that we're going to be discussing today. So again, what is a CHHA? It explains that, this is an individual that is employed by a home health agency, and, they follow designated nursing regimen put in place by a registered nurse, et cetera. But what I really want to focus on is the definition of licensed. Licensed, when we refer to this, we may use licensed and certification, interchangeably throughout the presentation. But what licensed means is holding a valid, current New Jersey license, certification, or registration that is required by law as a precondition to the practice of a regulated profession or occupation. So if you take anything away from this information, any home health aide needs to be certified prior to rendering any type of service. So again, when we reference license, that also means certified. And again, personal care services really goes into high level, defining what we expect with regards to what's being rendered service-wise. So as you can see, personal care services, they delve into activities of daily living. We expect to see assistance with feeding, toileting, bathing, things of that nature. Personal care services do not include the following tasks. So again, things related to housekeeping, meal preparation, things of that nature are not considered personal care services. They may be covered under other service categories. And again, you can reference the Medicaid website with regards to appropriate billing and coding of those services. But I want to reiterate that those types of services would not qualify solely as personal care services. And again, focus on the fact that services that are performed by unlicensed persons would not be considered eligible. So when we state unlicensed, we mean individuals that are not a certified home health aide. Okay, next slide, please. Okay, this is just, again, high level regarding the New Jersey Board of Nursing regulations. As discussed, they regulate certified home health aides. Again, as Geraldine previously pointed out, certification only happens after successfully completing a required training program, passing a competency evaluation, and then having a criminal history background check performed. All of that needs to occur, and it has to be submitted to the New Jersey Board of Nursing to be approved, and that individual to receive a certification and license number. This goes over high level what the New Jersey Board of Nursing is mandated to do, and that's to protect the health and safety of our New Jersey residents and our Medicaid beneficiaries. So again, high level off of this, I would bring your attention to the fact that, certified home health aides, they need to renew their license or certification every 2 years. One of the things that I've personally observed are licenses that are lapsed or are expired, meaning that the renewal process never took place. So that can cause delays. And again, when that license goes into expired status, we would expect that that individual not treat any type of Medicaid beneficiary until that renewal is complete and approved by the New Jersey Board of Nursing. Okay, next slide, please. And again, high level, the certified home health aide must meet these requirements. Again, they need to complete a course approved by the New Jersey Board of Nursing, specifically for homemaker-home health aide services. They have to successfully pass a competency evaluation. Again, hold a current and valid certification by the New Jersey Board of Nursing as a homemaker, home health aide. And as I previously indicated, it expires every 2 years, so they will need to be prepared for that renewal process. One of the things here too is completion of the federal and state criminal history background checks. So again, we're going to reiterate this multiple times throughout the presentation that that is the #1 delay in the processing and approving of applications is the background checks. Again, we need to have some type of documentation or promise of employment by a home health care services agency, and then of course, supervision by a licensed registered professional nurse. Okay, next slide. Again, this slide is imperative, so I want you to take this away today as well, because personal observations, we've seen multiple individuals that are certified nurse aides, and we have seen them rendering personal care services. I want to reiterate that this certification is for nurse aides who work in nursing homes and assisted living facilities only. Again, this is coming directly from the New Jersey Consumer Affairs, the Consumer's Guide to Homemaker Home Health Aid Services. This certification cannot be substituted for the New Jersey Board of Nursing's Certified Home Health Aid Certification. So please keep this in mind with your current staff and anybody that you'll be recruiting in the future. Additionally, any type of housekeeper or cleaning service or someone that's coming into the home to do that, they're not certified to provide personal or healthcare services. So if that's the intent of the individual going into the home and rendering the service and they don't have an active valid certification, that's not personal care services and it shouldn't be billed as such. Again, you can reference all available guidance to determine what the appropriate services and corresponding codes would be. And another observation, companion services. We've been seeing a lot of individuals that are companions that do not have a certified home health aide designation. Again, I want to reiterate, they are not certified to provide personal or healthcare services. They can provide light housekeeping and services not related to healthcare. And again, there may be a benefit available that you could bill under. And again, I have to reference guidance and, selecting appropriate coding. All right, next slide, please. All right, and finally, I want to touch on New Jersey Administrative Code regulations, specifically in relation to subchapter 14, healthcare service firms. This is very important. And again, we want to reiterate the licensing aspect. Anyone who has licensure to perform a healthcare service or function required by law has to have a valid license or certification number. Therefore, the responsibility for a personal care agency is to ensure that you're only referring individuals who are currently in good standing license-wise, currently licensed or certified. And as I stated, no board actions, no revoked licenses, suspended licenses. You want to ensure that that is a responsibility of healthcare firms when bringing on employees, is to initially check the licensing information. And we'll get into detail a little bit further in the presentation, but that is a responsibility when you initially hire, but also it's recommended that you do a monthly licensing check. And again, we'll touch on that in a few. And again, it is your responsibility to make sure you have the documentation in place, meaning that you have it retained within your facility. And we'll touch on that a little more in detail in the future as well. And all throughout the presentation, we have hyperlinks that bring you directly to these regulations, so you can, save them as your favorites moving forward, so you can easily reference these guidelines in the future should you need direction on how to proceed. Okay, next slide, please. All right, so that's it for me. So I'm going to let the next presenter take over. Thanks.
Thanks, Megan. Good afternoon. This is Becky Thomas, and I am actually with the Division of Medical Assistance and Health Services, but I'm going to do the presentation on behalf of HHAX today. Next slide, please. Thanks. So Geraldine did a nice overview of the Cures Act and the requirements around the mandate for electronic visit verification. So just a quick bringing it all back to this one particular area that we're discussing today as it relates to EVV and the state's aggregation vendor, which is known as HHA Exchange. We also refer to them as HHAX as part of our abbreviation and the love of all things alphabet soup here at the state of New Jersey. So again, this was signed into law in December of 2016. And part of the requirements for the Cures Act is that all personal care services, home health services, and private duty nursing services provided under Medicaid require electronic visit verification. And this is a process that uses an electronic means to verify the delivery of an individual's services in their home. Agencies can use EVV as an effective tool to track caregiver arrivals and departures, as well as ensuring that members are receiving the services that are intended and are authorized as part of their plan of care. There are 6 data elements that are required in the Cures Act, and must be captured to validate a visit through electronic visit verification. So I'm going to share them here. We're going to talk about them again, but I figure the more we talk about them, the easier it is to be clear on what those requirements are. So we need to capture the type of service performed, the individual receiving the service, the date of the service, location of service delivery, the individual who provided the service, and the time that the service begins and ends. So through through this process, the tools are required. EVV tools must be used to collect this data information so that the visits can be validated. And HHAX uses the visit validation to implement our in-scope services that we in New Jersey have defined, which is our personal care and our home health services, which I noted above. Also included in our launch is our in-scope waivers, which are our adults with developmental disabilities and intellectual developmental disabilities, as well as children and young adults with IDD as well. Next slide, please. So here we're going to talk through HHAX's framework and how they are in place as the state's aggregator and how that process supports the EVV requirement. So here's a diagram that demonstrates how HHAX facilitates this two-way ecosystem. So they're supporting our payers and the providers. So in this case, agencies such as yourselves. So let's start on the left side, and we can look at all the different provider solutions or provider functions within HHAX's system. So there's, you can schedule and manage your workforce through capturing and putting in all the visits, scheduling ahead of time, and then assuring that the visits align once they have actually been completed with how these visits were scheduled. It provides a check and balance. This is also part of the visit confirmation process. Again, aligns with plan of care management that we just talked about, making sure the services that are listed in the member's plan of care are being delivered. It also allows for clinical management and observation, so you can keep, there can be notes kept inside the member record. It also supports billing and payroll. On the right side, you can also see the payer solutions within HHAX as well. So we're going to start at the top with member and authorization management. This is a way that providers, through your unique HHAX portal, you can go in and put your unique members. Authorizations can be aligned and submitted. This also helps align for claim integrity. We want to make sure that the services that have been authorized were delivered correctly, and that all of those pieces align for claiming. It also provides an opportunity for provider network communications and alerts within HHAX. And it also has business intelligence tools that are used around data collection for monitoring EVV compliance. And as we noted before, the ability to review plan of care requirements for that individual to make sure the services that are being authorized and delivered align with the member's needs. And HHAX sits at the top of that diagram and is able to support and coordinate around these different pieces to support the agencies that are required to utilize EVV. For this conversation, that's our PCA agencies. So at the crux of this process, HHAX's job through the state is to aggregate all of this data for all of the providers and through their payers. So HHAX is the opportunity to collect all of that visit information in one place so that we can measure compliance, we can complete all reporting from the state point of view, and allows us to have that understanding through systems, through delivery, visits, and feedback to assure that members are receiving the services and providers are getting paid. So our next slide, please. So these are a few methods that are utilized for the collection of EVV. One of these methods is required to capture the visit data. So let's go through each option quickly. So first, there's a mobile app. Caregivers can use the app to clock in and out. It can be unique to each caregiver. They can include each one of their members that they care for with their unique schedules, and they can clock in and out based on those unique needs for that caregiver. It will record their schedule, their clock in and clock out, record their duties, and will create that solid clock in and out, meet those 6 data elements. There's another option through the telephone and IVR, also known as interactive voice response. So each agency has an assigned unique toll-free number for their caregivers to call from a member's phone to clock in and out. That way it captures location, the individual that it's treating, the clock in and clock out, and aligns with the individual providing the services. And last is a FOB, our fixed object device. This is a device that is secured in the member's home for capturing EVV. It will be used for the caregiver will call their agency's HH exchange phone number from any phone in the house to capture the clock in and clock out. It essentially uses different codes to capture the clock in and clock out information, and that can be transmitted back to the agency to capture that data if there is no mobile app or if there is no phone availability. So each of these are viable options. One of them must be utilized. If you do have any specific questions, please just drop them in the chat and I'll make sure they get over to our HHAX folks so they can reach out and help you out with finding the right option for you and your agency. Now I'd like to hand over the presentation to Jamila Vasquez of Aetna Better Health to discuss documentation.
Thank you, Becky, and good afternoon. Jamila Vasquez with Aetna Better Health in New Jersey, and I'll be just reviewing high-level documentation requirements and best practices. Okay, this slide here is accurately documenting services. So documentation should occur at the same time as the service is rendered. Documentation for billing must occur daily for each day you provide services, so all must be congruent. It is the provider's responsibility to know and comply with the documentation requirements. Next slide. Okay, requirements. So providers shall agree to the following: to keep such records necessary to fully disclose the extent of services provided, and to retain individual records for the greatest length of time that applies from the date the service was rendered. To timely furnish information such as about services as requested by regulatory agencies, including the Medicaid Fraud Division. If records do not document the type and extent of services billed, payment adjustments are necessary, including requiring repayment to Medicaid or claim payment denial. Okay. All records and documentation used to support billing must be individualized. They should all reflect actual services delivered and should include the individual's name, the date of the service, time, duration, the specific services rendered, such as, your typical ADLs or IADLs. ADLs can include bathing, eating, and grooming, and your IADLs or your meal prep, laundry, housekeeping, and cleaning, for example. Okay, timesheet documentation. Description of the encounter and notation of unusual occurrences. So signature of the person authorizing the note is a requirement. The signature of the supervisor, if required. Service delivery encounter documentation forms must be signed by the caregiver. Care plan documentation. Some takeaways here: the note should align with the service or treatment plan outcomes and strategies. It should answer the who, what, when, where, and why of the service provision. And the note should be completed by either the individual providing the service or an individual responsible for the oversight of the direct service provision. If the note is completed by a staff member not providing the direct service, they should have documentation to support the information contained in the note. The care plan documentation should reflect progress towards or decline from identified outcomes. And the note should comply with PCA requirements as detailed in the New Jersey Administrative Code, Title 10, Chapter 633.6, clinical records. Okay, some cannot, some no's. So the note cannot be completed by a staff person not connected to the service provision, and it should not be duplicative or generic in nature. Okay, documentation must. So providers using an electronic health record or other electronic system must ensure that all information required in mandatory sections is included and individualized for the recipient, and that all underlying documentation can be produced to support services rendered during an audit or an investigation. Okay. Records documentation must accurately reflect the services that were rendered. Documentation should occur at the same time as services rendered. Medicaid will not pay for undocumented or improperly documented services. So these are some takeaways as best practices. Don't shortchange yourself if it's not documented or not documented correctly. It wasn't done. Thank you. Kick it off to Dimas.
Thanks, Jamila. So Becky Thomas, again, from TMOS. Now we're gonna talk through records, retention and billing practices. So if we can go to the next slide, we'll kick it off with record retention. So approved by Medicaid, NJ Family Care, enrolled personal care agencies shall retain in a secure location and in compliance with all applicable federal and state laws and regulations confidential information related to the individuals providing or supervising the provision of services, and shall produce the information from any authorized agents in an orderly fashion on demand. Essentially, a lot of words to say. Please make sure that your member information follows all required needs, is easily accessible when required for any sort of review from either federal or state individuals that need to look at your records. It's really, we can't express the importance of assuring that your records are in order, follow requirements, which we'll move to in just a moment, and are accessible as needed. So if we could go to the next slide, wanted to talk through the importance of record retention timelines. I think we all, I'll be honest, it's one of those things where I'm always trying to remember, which timeline is this? And here we can see there are 3 different timelines. So it depends on the source. So we have one in our administrative code in 1037-6.77 that there's a requirement for adults must have their information retained for 5 years after the last date of service. And records for children must be retained 5 years after they reach their 18th birthday. And then if you go to our managed care contract in Article 7.28.a, it's a 10-year requirement. So if you are not clear, please visit the regulation or the MCO contract and review which is applicable based on the case that you have for that person. Make sure it aligns with the appropriate question. And if you're not sure, ask. Next slide, please. So let's move into billing and coding. Now, billing and coding is the responsibility of the provider. We want to make sure that you're using the right codes so that you are accurately reporting services rendered, that they are required for the individual, and that this is the way that you will receive appropriate payment for those services. So again, the importance of making sure that it's the correct service, it aligns with the member's needs, and that you are billing appropriately. So if we want to go to the next slide, we can look at the codes that are impacted. So we have our different codes as they align for personal care. We have our 15-minute For individual or group, we have a per diem, and then we have the codes that directly apply to the MLTSS individuals that are included in our PCA EVV launch. Next slide, please. So I said it before, bears repeating. It is incumbent upon providers to be knowledgeable regarding the codes that are used to reflect the services rendered. This is one of those areas where it will have, as you, if you're new to this, you'll understand, why did I get an error? Why do I have an issue when I'm billing? It's the importance of making sure that the coding aligns with the member need, the prior authorization request. All those pieces are going to need to align to assure that everything is in the correct process in order to have it authorized, set up visits, have the visit validated, and then be able to submit for claims payment. So let's talk through those unique billing practices on our next slide. Thank you. So first, we did do the talk through the federal mandate requirements. So these are our 6 elements. You can read them. I won't read them to you again. But what I do want to bring attention to is the New Jersey EVV provider billing. We in New Jersey want to go a little bit more secure, and we want to look for clear alignment with billing practices on our EVV side. So what we have added is that the rendering provider, either their license or certification number, is required for EVV claims payment. That information has to be provided within, it has to be included in the member record in EVV to assure that the individual providing the services, we had a great section to talk through all of the requirements for certification. That certification number needs to be included with the member's information in EVV. And it also, we require that the prior authorization aligns with the visit data. So these 2 pieces are necessary in New Jersey for billing for personal care assistance services. Next slide, please. So this is just a little update or a clarification around the EVV certification requirements that we currently have. There will be more to come, but to clarify what it is to date that we are expecting. So we require license or certification information in the aggregation system for rendering service providers, also known as caregivers, for personal care services and home health care services. So our focus is personal care, but the licensing and certification requirement is to ensure New Jersey family care members are receiving care from qualified providers. So the provider license and certification applies to the following at this time. So to note, first up is our certified home health aides. This also applies to registered nurses, licensed practical nurses, physical therapists, cognitive therapists, occupational therapists, and speech therapists. We do have a link there to one of our newsletters that also has this information for your reference. Next slide, please. So this is another piece where the ownership is definitely on the provider, but this is an opportunity to be proactive by identifying and correcting errors in member documentation as quickly as possible, so that you know that any issue that you have managed it and addressed it appropriately. So first recommendation, implement a robust system of quality assurance and oversight that reviews compliance on an ongoing basis, adjusts service delivery to maintain outlined standards. Also, supplemental documentation to a note can be added if necessary, as long as the date of the addition is included, as well as the initials of the person supplementing the record. So here are a couple examples of actions that can be taken when identifying an error. You want to notify the MCO within a timely manner of an error once it's been identified. You also want to educate your staff and employees to prevent the error from happening again. It's really that staying on top of your records, part of that oversight and making sure that communication is open so that there's no incident of going back and seeing a potential billing error or a code misuse, anything of that nature. Making sure that your coding is done correctly, making sure that your billing aligns with your requirements, and that you have your all the pieces in line to make sure that your billing is solid and clean is a really valuable takeaway from the portion here on billing and documentation retention. Now I would like to hand over the presentation to Tracy Livingston of the Medicaid Fraud Division, and he is going to discuss compliance and the Medicaid Fraud Division. Thank you.
Hi, good afternoon, everyone. Again, my name is Tracy Livingston, and I'm from the Medicaid Fraud Division. What I'm going to talk about is your compliance program, and then just some things from elements that should be in your program that we're going to suggest for you guys. So one of the things we want to make sure that we're clear is that everybody's compliance program is a little bit unique. There may be some things that you do more than one agency, or some things that you deem are more important. We're going to tell you, I'm going to show you the things that we look for when we look at your records, we do any kind of audit investigation, so you know what we're looking for as part of your compliance program. Next slide, please. So here are 6 steps that we came together, we came up with for this towards compliance. The first one is providing the clinically appropriate services as identified in a treatment plan. So essentially, if you document that you provided a particular service, so let's say that if you documented that a physical therapist went out, make sure that the documentation matches the actual clinician that actually went out to the patient's home. So we were talking about EVV earlier, just making sure that if your records show that you had a physical therapist, that the EVV will also show that it was a physical therapist and not a nurse. Accurately documenting the services, the who, what, where, how, when, and how. So this is one of those areas where when you document your services, we don't really tell you what to document, but what we really were looking for is that you can give us a clear picture on the services that you provided. So if you do that and you tell us who, what, where, when, and how, if you remember that, your documentation should be pretty good. Instituting responsible billing practices, I think that goes without saying. Properly supervising all employees' provisions of services. This is a really important point to remember, because sometimes we'll hear when we look at things and we'll go, well, I didn't know the aide was doing this, and I didn't know the nurse was doing this. We just wanted you guys to make sure you understood that everything starts with you guys, and you guys have to make sure you monitor your employees. So that's what this section here is for. Establishing a system to identify and correcting the errors and omissions concerning credentialing, documentation, and billing. This is also really important. I think we also addressed this later in our presentation. One of the things that we know, and I'm sure you guys know as well, sometimes you may do something incorrectly, and you may do something incorrectly where it was just a mistake. What you really want to make sure is that you have a process in place, so when that occurs, that you have a way to correct it and also report to us if necessary. Adhering to waiver and regulatory standards where applicable, including hiring practices, properly completing the Medicaid application, and training yourself and all staff on their requirements. This is really what I mentioned earlier about making sure that not just your CFO or your CEO understands the rules and regulations, but everybody's throughout the organization, so that they're clear on how things should be happening and what your expectations are as far as the compliance program. Next slide, please. So consequences, and we put this slide here because we wanted to just make sure that you guys understand the consequences of not having a compliance program. So non-compliance with Medicaid rules, standards, and regulations regarding services may constitute acts of fraud, waste, and abuse in Medicaid funds. And again, I'm from the Medicaid Fraud Division, and this is the main thing that we do. So we want to really make sure that you guys understand this slide here. Next slide, please. So I mentioned for the Medicaid Fraud Division, and if you guys don't know, this slide talks about how our division was created. And it was basically created with the Medicaid Program Integrity Act. And it was established at that time from the Office of Medicaid Inspector General to detect, prevent, and investigate Medicaid fraud and abuse, recover improperly expended Medicaid funds, enforce Medicaid rules and regulations. We also audit cost reports and claims. And also something that I think a lot of people in the community may not realize, we also review quality of care given to Medicaid recipients. So we're looking for fraud, waste, and also abuse. Okay, so this is something also that our office looks at. And this is really important in the arena that you guys are providing services for, because you guys are actually going out into recipients' homes. And when you get out to those recipients' homes, that can be a vulnerable position for those recipients. So we also get complaints on abuse as well. And that's also something that comes through our office that we take very, very seriously. When our office was established, we were established under the Office of Medicaid Inspector General. Those duties were later transferred over to the Office of the State Comptroller. So we actually are part of that agency, and we're a division of that agency currently today. Next slide, please. The Medicaid Fraud Division. So we perform program integrity functions. And when we mention program integrity functions, it's sort of similar to the prior slide. We do audits, we do investigations, and we also, and with each of those functions, we're looking for potential fraud, waste, and abuse by providers and recipients. And that's another thing we also wanted to bring up with the recipients, which is really applicable to you guys as well, because with the PPP program, we also have to look at recipient fraud. And that's something also that we pay attention to as well, because in some situations, the fraud really is not only coming from a particular provider, or it may not be coming from a provider at all. It actually may be coming from one of the recipients. So when you guys see that, that's something that the MCOs and the Medicaid Fraud Division needs to know, because one of the main functions of why we do what we do, we're trying to make sure that the taxpayers' money that's used for these services is being spent correctly and efficiently. So that's also why we also look at recipients as well. So if you find anything from a recipient fraud standpoint, you also can report that to us, and we'll also show you that information towards the end of the presentation. We also, as you can tell from this presentation, we help to coordinate the program integrity oversight efforts among all state agencies that provide and administer Medicaid services and programs. So that's just a fancy sentence of saying that we all try to work collectively together. That includes the Medicaid Fraud Division, that includes MFUCU, all the MCOs, and other agencies that's on this presentation. We find that if we coordinate correctly and we do it efficiently and promptly, we can address a lot of issues on the front end. We do that because, again, our goal is to look for fraud, waste, and abuse in the program, but we're doing that so we can make sure that money isn't wasted in the program. And as I also mentioned before with the recipients, we want to make sure that the recipients are getting good quality care. So in order for us to do that, we have to reach out to some of our sister agencies and also to the MCOs so we can make sure we can coordinate those efforts together. Next slide, please. So the Medicaid Fraud Division also works to recover improperly expended Medicaid funds, enforces Medicaid rules and regulations, audit cost reports and claims, review the quality of care of the Medicaid recipients. And I can't stress that enough. Again, something that with the PPP program, we're really taking a look at, and excluding and terminating providers in the Medicaid program where necessary. Now, this is something that I didn't mention before, and we talk a little bit about this later in the presentation. One of the things that we also do, we make sure that if we have a provider and that provider is not providing the care that they're supposed to provide, we look at that provider and we make a determination whether or not that provider needs to be removed from the program. The reason why we do that, again, is because we're talking about taxpayer dollars. We're also talking about the safety of the recipients, because again, you guys are going out in these recipients' homes. And then the other thing as well, if we are able to remove providers who are not providing proper service, then that means all the other providers, which is the majority of the providers in the program, you can get the rates that you deserve, right? Because like if we're paying providers who should not be in the program, that's wasting money for not just the entire program, but for you as a provider as well. So we take that very seriously. And the other thing as well, we exclude providers, and then based on what we find, we may make a recommendation to terminate that provider as well. So that's one of the functions that we really take seriously in our office as well. Next slide, please. Okay, so I'm now going to turn the presentation over to Brittany Sitchell. Thank you very much.
Thank you so much, Tracy. As he indicated, my name is Brittany Sitchell. I'm from United Healthcare Community Plan, and I will be discussing what is fraud, waste, and abuse. Fraud is defined as an intentional deception or misrepresentation made by any person with the knowledge that the deception could result in some unauthorized benefit to that person or another person, including any act that constitutes fraud under applicable federal or state law. Now, some of the consequences that can be linked to fraud, waste, and abuse are civil judgments and liens, exclusion from the Medicaid or Medicare programs, suspension or loss of professional licenses, referral for criminal prosecution, restitution or recovery of overpayments, and additional penalties in addition to repaying those Medicaid overpayments. Waste is generally understood to encompass overutilization or the misuse of resources and is not usually considered a criminal act. However, it is considered a legal violation for civil purposes and can result in a recovery of an overpayment, debarment from the Medicaid program, and other penalties as well. Abuse is defined as provider practices that are inconsistent with proper, sound fiscal, business, or professional or service delivery practices that can result in unnecessary cost to or improper payment by Medicaid, or reimbursement for services that are not necessary, approved, documented, and that are outside those specifically authorized. Now, there are some business practices that can result in waste and abuse rising to the level of fraud. Some of those examples are providing services without proper authorization. Of course, emergency situations are excluded from that. Using unlicensed, unqualified, or untrained staff, inaccurate or incomplete documentation of services, billing for undocumented or unsubstantiated services, and insufficient internal checks and balances in place. And now I'll pass this over to Dave, who will provide you with some audit finding examples.
Thank you, Brittany. I'm Dave Kuchar from the Office of the State Comptroller Medicaid Fraud Division. And today I would like to share with you a few of the audit findings for personal care services. Next slide, please. During one of our audits, the Medicaid Fraud Unit found that the provider failed to verify a home health aides professional certification before rendering services. The service was rendered on December 30th, 2015, but the home health aides temporary home health aide permit had expired on June 30th, 2015, resulting in the home health aide performing services 6 months after their permit had expired. It is the provider's responsibility by the home health aide's professional certification status of each individual performing personal care service prior to performing services, and the professional certification must be retained in the agency's personnel files. Next slide, please. In another one of our audits, MFD found that the provider did not timely perform an in-home evaluation of the home health aide and the plan of care. According to state regulations, personal care service providers must perform an in-home evaluation of the home health aide and the beneficiary's plan of care at least once every 60 days. The timely completion of home evaluation is required to evaluate the home health aide's performance and to determine whether the services called for in the plan of care meet the needs of the beneficiary. OSC found that the beneficiary received services on August 22nd, 2016, while the supervisory visit was dated February 29th, 2016, resulting in a period of 175 days without having the provider perform an evaluation. Next slide, please. Another finding was the failure to prepare a plan of care prior to initiating services. Personal care service providers must evaluate the beneficiary's needs and establish a written plan of care prior to initiating services. This requirement ensures that personal care service providers identify the tasks and hours of service needed before sending a home health aide to provide services. It also ensures that the home health aide knows the beneficiary's needs before providing services to the beneficiary. MFD found a provider billed for services dated September 9, 2016. However, the plan of care was not performed until 3 days after, on September 12, 2016. Next slide, please. Another finding was where a provider billed personal care services while the beneficiary was an inpatient in a hospital. According to Medicare regulations, the beneficiary cannot receive personal care services, private duty nursing, or in-home nursing services while Medicaid is paying a hospital for room and board services for the same beneficiary. MFD's data mining unit created a report comparing claims billed under code T1019 to claims with dates where the same beneficiaries were in the hospital. It should be noted that the report excluded both the admission and the discharge dates, since both inpatient hospital services and personal care services can occur during the admission date and discharge date. OSC obtained admission and discharge data from the hospitals, which confirmed that the beneficiaries were admitted to the hospital at the time of the PCA service. Next slide, please. A more common finding is overbilling of hours. This occurs when the documentation in the patient chart reflects less than what was billed. In this case, 3 hours of services were documented, but 6 hours were billed, resulting in an overpayment of 3 hours. Also, overbilling occurs when the patient chart does not document any time in or any time out. Next slide, please. Another finding is where there is no in patient care, which makes it impossible to determine whether the patient care plan is being followed. This occurs when a patient's chart documents the aide's time of rendering the service, but the actual services rendered, such as bathing, grooming, etc., are not documented as being performed. Next slide, please. And the last example of PCA findings is when both the EVV reporting and the patient's chart reflects that the CHHA rendering the personal care service was unlicensed. Below, as previously shown, are the 6 federal EVV elements and the 2 New Jersey EVV elements that need to be reported. In this case, the individual providing the service did not provide one of the elements to document the license/certification number. Thank you very much, and I'd like to pass it on to Megan Brennan.
Thanks, Steve. Okay. As promised, I'm going to discuss some additional best practices and tips. But before we get into, this informative information, I want to make a disclosure that, based on the managed care organizations and New Jersey Consumer Affairs experience in this area, we're trying to help providers improve their documentation and performance. And again, with the disclosure on the slide, this is not intended to imply that simply following these steps will mean that the provider will be held harmless in the event of a review, investigation, and or audit. Essentially, when in question, the best place to reference is the source of origin, which is the New Jersey Consumer Affairs website, New Jersey Board of Nursing website, the license verification website. Those are the best places to go. All right, next slide, please. Okay, as I said, we previously referenced the best practices for healthcare service firms earlier in the presentation. This is very important. New Jersey Consumer Affairs indicates basically the following must occur prior to any referral or placement of a licensed, certified, or registered individual. And again, we had gone over this in previous slides, but we want to again emphasize that this is the provider responsibility. You want to ensure that you have personally examined a copy of the original license or other reliable verification source, which is, again, the Consumer Affairs License Verification System, which I'm going to go into. And again, there's going to be hyperlinks for you to be able to utilize that'll bring you directly to these sites. Okay, again, it is imperative you want to maintain a copy of every employee's current license, registration, or certification. Okay, you also want to maintain a copy of documentation obtained directly from the Division of Consumer Affairs and their online verification page. So best practice would be to print out a copy of the license verification page reflecting the license number of the employee and the status of their license. It will be date and timestamp for that exact date when you're checking it. So again, best practice is to have this information on hand and perform these processes. Again, the reason that I'm emphasizing this is because you may be asked to furnish this information during any type of review, audit, or investigation. And again, that's to verify compliance that all employees have the appropriate licensure, certification, or registrations in place. So please keep this in mind. All right, next slide. Okay, as stated, this is what the license verification website looks like. Again, it's through the Consumer Affairs webpage. Best practice for me personally is, in order to search for license, of course, the best way to do so would be to have that individual's license number. But if for some reason you don't and you're attempting to search by first and last name and possible city, some tips to narrow down results is when you go in, you can actually hit the drop-down menu. You want to select profession nursing. That's where you're going to find licensure and certification information for certified home health aides. And again, you can, whittle it down even further by selecting a specific license type. So again, you want to select homemaker HHA. So at least that will narrow down your results, keeping in mind this license verification database is basically for any board that requires licenses. So you could go into plumbing, MD licensure, and home health aide licensure. So this will help narrow it down. But again, best source would be the license number of the individual in question. Okay, so next slide, please. So again, full name, license numbers have, of course, been protected. But what I really wanted to emphasize here are a few things. So the most important thing that you want to take away is the license status. It will tell you the exact status of the license as of the date you're entering the web page and verifying the license information. So again, you can quickly see if it's expired, deleted, active, again, revoked, suspended. Normally when you see the full name, when the information is not redacted, it's a hyperlink. So what you do is you can click on that individual's name and it will bring you to a page that gives you important information. It'll tell you the license status, whether it's expired, active. It'll tell you a status change reason. Say that a license was previously suspended and it's been reinstated. It may indicate that in that system. It'll give you the issue date of the original license, and it'll give you the expiration date of the current license. And again, keep in mind that license renewal is required every 2 years for certified home health aides. And again, most important, it will tell you if any board actions may exist. If you go into the page and verify this information, it will indicate yes or no. And again, if you utilize New Jersey Consumer Affairs webpage, you can actually look up the disciplinary actions as well, and you may be able to pull up the information regarding the board action. If not, there is contact information for the Board of Nursing where you would be able to contact them directly for that type of information. Okay, next slide, please. Again, I can't emphasize this enough, and this comes from review of existing EVV reporting. Some issues that we've come across personally when reviewing is correct spelling of this, the aide's name. So a lot of times we'll see something come in where the aide's first name is actually reversed, where they have the last name in the first name section and vice versa. So it's very hard for us to be able to locate the licensure in the verification system. So you want to make sure that you have correct spelling of the first and last name. It's in the correct order, first name first, last name last. You also want to ensure that it matches the name on the license. We've seen a lot of instances where someone may have, changed their name through marriage, and what's being reported through the EVV system does not match what's in the license verification page. And again, you want to make sure that you're providing the correct provider license or certification number. Again, they're interchangeable. The license number in the instance of certified home health aides would be the certification number. So you want to ensure that that is absolutely correct coming through and it matches the number that is in the license verification system. All right, next page. So we did go over this previously. Geraldine did a fantastic job going over tips, for applicants and, giving background behind the top 3 delays. So again, what I can emphasize here is exactly what she did. You want to ensure that you are scheduling criminal history background checks immediately when appropriate. You want to make sure that you schedule the fingerprinting appointments as soon as email instructions are received, because again, it is the #1 reason in delays for the application process. The letter of completion is the #2 reason for delays with applications. Again, the training program for the certified home health aide. Basically, they must upload a letter of completion, an assessment of skills, or similar documentation, in order to start the process. Determined by the board. So I apologize. Unfortunately, the slide was cut off for me. So I just saw it. All right, next slide, please. All right, and again, this is the #3 reason for delays. Again, potential employer, that would be you as a healthcare firm or a healthcare services firm. You must upload a promise of employment to the portal, and this is imperative. You must add all certified home health aides to your employee roster. So you want to keep that updated at all times because, again, must emphasize this information can be requested during any type of, medical record review, audit, or investigation. And must indicate that if there is previous criminal history on file, again, this is coming directly from the New Jersey Consumer Affairs webpage, phases and timelines, and again, the hyperlinks right there for you to access this information. But if the applicants have a prior criminal history, again, the application is going to require additional review by the board. And again, if you have any questions regarding this, your best point of contact would be the board directly. Next slide, please. Okay, so I'm going to turn it over to Melanie. Thank you.
Thanks, Megan. And in the interest of time, I might jump around just to make sure we can get the last little bit covered, but I'm going to touch on ineligible providers, actions, and self-disclosures. So MFD has some tools in its toolbox that it can take when it does identify overpayments as a result of an investigation or an audit. And you'll see those on the screen here. If you were or are in the future involved in an audit or an investigation, you will receive information dependent upon your specific case. I want to spend a little bit of time on ineligible providers. So this is someone who's excluded from participating in federal or state funded healthcare programs, and products and services are ineligible for payment, whether they're furnished directly or indirectly by an ineligible provider. So it's really important that those checks are performed monthly upon hire, and that you're familiar with whether or not your staff are eligible or ineligible. We do have a newsletter linked here that you can reference for more information. And this is a list. I will not go through it all, but these are different websites that can be checked and should be checked to verify eligibility. I want to emphasize the last one, number 7. So if your provider is out of state or given that we're in New Jersey and we're on the border of other surrounding states, it's imperative that you check other states' exclusions and debarment lists to make sure that they aren't ineligible in another area and are just coming over to New Jersey to render services. As Tracy touched upon, when you find problems within your own organization, we ask that those be self-disclosed to us. And in fact, they're required to be self-disclosed to us within 60 days of identifying them. We do have a self-disclosure form and a process on the Office of the State Comptroller website. So strongly encourage you to take a look at that and familiarize yourself with that. And if you have questions about that, please don't hesitate to reach out to the Medicaid Fraud Division. We'd be happy to work through with you. And I'm going to turn it over to Detective Jaruzelski from the Mafuku to talk about the Mafuku.
Good afternoon. My name is Lieutenant Joseph Yaroshevsky. I'm with the New Jersey Medicaid Fraud Control Unit. Next slide. I just want to emphasize that Medicaid fraud is an extremely serious crime. It's so serious that the state has an office which is dedicated solely to investigating Medicaid fraud and related matters. Our office is made up of attorneys, investigators, nurses, auditors, and other staff that help us police the system. Right now, we have offices in northern New Jersey and central New Jersey, and we are in the process of expanding into southern New Jersey as well. Next slide. Now, we investigate various aspects of the Medicaid program, any fraud involving healthcare providers, any kickbacks in the system, any fraud in the actual administration of the program. We also look at other federally and state-funded healthcare programs if there's a nexus to Medicaid fraud. But one thing we also do, and this impacts home health aides, is we investigate abuse of patients and financial exploitation of patients. Next slide. So we use 2 statutes mainly in the investigations of the fraud cases, the Medicaid fraud statute and the healthcare claims fraud statute. Now, both of those statutes normally result in a violator being sentenced to state prison time. So these crimes are extremely serious and often result in state prison, in addition to possible loss of license, and other penalties, fees, and restitutions, and being debarred from state and federal healthcare programs. Next slide, please. Some things I just want to point out, that if you are a practitioner and you get convicted of healthcare claims fraud, you only need one false claim, just one, and you can be convicted. That willful ignorance of the truth or falsity of a claim is not a defense, that there is reckless healthcare claims fraud. So if your conduct isn't even intentional, but only reckless, you can still be convicted. Next slide. Sum things up. Ignorance of the law is no excuse. It's the provider's responsibility to know what the laws are and to follow them. Thank you.
All right, so we're right under the wire here. We're going to get wrapped up. Once we have this posted on the Office of the State Comptroller website, you will have access to all of the links and resources provided. On this slide is ways for you to contact us. So if you get back and you're doing your day-to-day and you have questions, please don't hesitate to reach out. We also have included the various fraud hotlines, not only for the Mafugu and MFD, but for the 5 managed care plans. And while we still have you, if you could just answer a few brief questions, letting us know what you thought about today's presentation, we would really appreciate it, and would take your feedback to improve any future presentations that we provide. As I mentioned, we will compile a question and answer based upon the questions we received today, and we will share that with all of the attendees so that you have that as a reference tool to look back upon. And we really appreciate everyone's time today. I know summer schedules can be difficult, and to join us, today in the peak of summer, we really do appreciate it. I'm going to end the poll, and I am just going to also show you this resource here. Again, if something comes to mind and you're not sure how to direct your question, you can always submit it to this mailbox, which is something that I monitor, and I can triage to a resource that could better suit, help you get an answer. And don't be a stranger. Here is how you can stay in touch with us. We really appreciate you being with us today, and we are going to end right on time here at 2:30. So thank you again, everybody, and enjoy the rest of your afternoon.